Morning, everyone. It is the top of the hour, so we will begin our presentation for today. We want to thank you for joining our first kickoff session for skilled nurse for assisted living facilities and personal care homes. We're working together at Alliant Health Solutions with the Georgia Department of Public Health and University of Georgia, as we will mention in just a moment. Next slide, please. Today, our presenter will be Teresa Fox with the Georgia Department of Public Health. She is going to be bringing you some information on infection prevention programs, and some websites that you may want to go out and venture to see the state statistics for the state of Georgia. I'm Melody Brown with Alliant Health Solutions. I'm the Patient Safety Manager and will be facilitating the program today. In the background as well, we have Rakia Campbell, who will be operating our slides and controlling our technology, and Linda Kluge is on. She is our Executive Director at Alliant Health Solution. And in addition, we have Amy Ward, one of our infection preventionists, on with us today too. Next slide, please. Again, we want to thank our partners with Georgia Department of Public Health and University of Georgia, for without them, we would not be able to bring you this presentation today and this work. Next slide. The purpose of these sessions will be, we're going to have some regularly monthly scheduled sessions for this slide should have been changed, and I do apologize for that. This should be for assisted living facilities and personal care homes. We're going to bring updates on infection prevention, clinical protocols, and ideas for tools and resources that we are either have developed or are in development with. We ask that you be present with us and actually put your comments and thoughts into chat or the Q&A box. So at any time, please just enter your comments or thoughts as Teresa is going through the presentation today, so that we can make sure to think about that or know what's going on out in your world as you are working with your folks every day. We're going to have some subject matter experts. Again, we have Teresa Fox on today. We have Regina Howard with the Department of Public Health, as well as myself, Amy Ward, who is our infection preventionist, and we have Donald Chitanda with Alliant, who is an infection preventionist. Next slide, please. We completed trainings this week for all of you, and we hope that you were able to attend. If you were not able to attend, we do have all of the presentations posted on our website, which I'll drop the link in just a few minutes for. We have the trainings. We also have recordings of those trainings. So we ask that you take a few minutes if you were not able to attend and go out and just listen to those or use the slides if you need to, and some of your education with your staff. We're going to do big trainings again down in October, but until that time, we will have this call every Friday at 11 a.m., the fourth Friday of every month. And so we ask that you join in with us and let us know what you're seeing. Let us know what you are having issues with or barriers, and we hope that we can provide information that will help you overcome some of those barriers. But we also want to hear about your best practices. So, next slide. And again, your opinion matters to us. Please chat up the chat box as well as the Q&A, because we do want to hear from you and hear what's going on out in your world as you are faced with everything every day. Next slide. So at this time, I'm going to turn the presentation over to Teresa Fox. Teresa, the floor is yours.
Thank you, Mel. And thanks, guys, for letting me talk to you today about a little bit of infection control. And one of the things that we want to talk about is, which guidelines should each facility follow? We know nursing homes are CMS guidance. And if you receive any kind of Medicare or Medicaid funding, you must follow the CMS guidance. But CDC guidance and the CMS guidance are very closely married. And if you're one of the other facilities that does not fall in that group, you are to look for CDC guidance. I want to remind you that the Georgia Administrative Order is no longer in effect. It had some really good ideas in there, and a lot of those things should be carried on. Next slide. So what we're going to talk about today is, our team, the HAI team, and I'm sure a lot of your facilities have had interaction with someone from our team as far as doing COVID assessments in your building, providing recommendations, and general information. And so what I did is I looked back through our assessments. And next slide. I came up with the things that most often occurred. And one of the things that when we looked at them was that we saw constant turnover of staff in the facilities, including leadership. Therefore, we keep going back, and it was just a hard time for everyone as far as staffing was. People were afraid and they were leaving. So that became a real hardship, not only for skilled nursing, but all other forms of healthcare settings. And then specifically in our ALFs and patient care homes, we noticed that there was a lack of being a defined person in the role of infection prevention, which you've never had to deal with that. So that was not surprising. But what we did learn over the time was that facilities worked hard to identify someone in their building to take on that role. Sometimes it was the executive director, sometimes it was the CEO, sometimes it was the nurse that was in that facility or part of the nursing, chief nursing officer. But they also had so many other jobs at that time, they didn't have time to fully read, understand, and do in-depth surveillance for what was going on. The other thing that we identified is, there were a few guidances out for behavioral health, such as your dementia units, but they were only minimal. They did not cover everything that needed to be going on, especially during a pandemic such as COVID. So the other thing, especially at the beginning, we noticed a lack of available PPE. You didn't know what to get, where to get it, or how to get it. You didn't know effective cleaning and disinfecting policies, which was really important for preventing the transmission of COVID. Testing kits, who tests, when tests, don't have access to a laboratory. So there was lots and lots of things that occurred in this segment of healthcare that we'd never had to address before. And I'll tell you, you guys were champs. Y'all got out, you found what you needed to do, you established your relationships, and you got to the resources that you needed. So I'm going to give you kudos for that. My only caution would be is don't let those resources and don't let those relationships go to the wayside. Keep those in place because we never know when something else may occur. And then the last thing was when the vaccines came available, patient care homes and assisted livings were unsure where they were going to get their vaccines, how they were to be administered, who was responsible for that administration. So there was lots and lots of questions about those. But as I said, you guys really worked hard and answered a lot of your questions and got your resources in order. Next slide. So, right now we're talking kind of in the lull of COVID, and we wanted to talk about how do you ensure that the visits that are going on in your building are safe. One of the things you have to do is look at your facility structure and what are your residents' needs. Can they visit in the residence room or resident apartments? Do you have a designated area for visitation, or are you going to do outdoor areas for visits? So keep those things in mind when you look for the future. And one of the things that they often point out is you must have in place what's called the infection control best practices to reduce the risk of COVID-19 transmission. And people say, well, what are those? I don't know what best practices are you talking about. Next slide. So we compiled basically for COVID, what should your best core practices be in your facility? One, you should continue to screen all visitors, vendors, and staff for COVID at this time. That has not been changed. Any visitor that comes into your building should meet a minimum of the below criteria. They cannot have a positive COVID test. They cannot be exhibiting signs of COVID, or they cannot be currently in criteria for transmission, like they've been exposed and they're still in isolation. They should not be admitted to your building. You should be teaching and ensuring that both your residents and your visitors are practicing good hand hygiene. The second thing is cough etiquette. We've forgotten a lot about that. Cover your cough, sneeze into a tissue, wash your hands. All of those things should still be in place. The next one is appropriate selection and use of PPE. That includes your visitors as well as your staff, making sure that that PPE is on appropriate and it is the appropriate PPE for your building. And then social distancing is a major infection control prevention, especially for COVID, because we know that it drops out within the 6 feet, and we like to keep that social distancing as much as possible. When I talk about social distancing in AFs, I'm really talking about in your communal areas. You're not going to practice social distancing or invest that in their apartments, but when they're in your communal areas, you need to make sure as much as possible that you have social distancing happening. CMS and as well as us, we recommend have instructional signage posted in your building. You cannot assume that your visitors or your residents know how to wash their hands. How many times do you go up and down a hallway and you see masks that are inappropriately placed? Either it's below their nose, it's below their chin, they got straps crossed, all kinds of things that you're going to see. So you need to make sure that your residents as well as your visitors know how to apply and remove their PPE. You need to have a place for them to dispose of them. You want them to wear them in your buildings, so have a place for them to dispose their used PPE. One of the things that we noticed very quickly in AFs and patient care homes was a lack of understanding of what environmental cleaning and disinfecting was. We've talked a lot on our calls about the 2 steps for cleaning and disinfecting. One, it's cleaning is step 1, and then step 2 is disinfecting. You cannot disinfect if your biohazard, which is the dirt and stuff on your surfaces, are so much that it does not allow that disinfectant to touch the surfaces. So we talked a lot about appropriate cleaning, disinfecting, making sure that you're using the right products to do that with. We talked about the EPA list for appropriate products, so keep those things in mind. This is one that we talk about effective cohorting in residents. Doesn't really apply a lot to assisted livings because those are usually independent apartments. But when you get into behavioral health or dementia units, sometimes we would see where you had roommates or others. So keep cohorting, making sure that you're keeping your residents safe. And the last one is appropriate resident and staff testing. Next. A picture speaks 1,000 words. If you'll notice on this graphic, I talked about hand hygiene. We would like to see a hand hygiene, how to do it when people come into your buildings and in your common areas. And then we talk about how to use a hand rub. There is a specific method or technique for using a hand hygiene, hand rub. You don't just put it under your, plop it in your hands, rub them together, and you're on to the next one. So we need to make sure that we are using those appropriately. And then you can say, I've got to cover your cough, I've got vaccination, 6 feet, all of the signage that we would request that you put in there. Okay, next slide. So one of the things that we often talk about that changed again on May the 24th is how does CDC define vaccination? So on the 24th, the up-to-date means that a person has received all recommended COVID-19 vaccines, including any booster or boosters that they're eligible for. So if you are considered up-to-date when you have completed your primary series, but not yet eligible for a booster. The next one is you have received your first booster, but not recommended to get a second booster. And the last one is you have received the first booster, but you're not yet eligible for your second booster. So those were the changes to the up to date. And we'll see in a minute why those changes are important to you. And of course, the fully vaccinated has remained the same. That means a person has received their primary series of COVID-19, but has not completed the recommended boosters. Next. So, I talked a little earlier about visitor and residents. When you're having visitors in your building, you need to be able to discuss with them what's the risk associated with visiting in your facility. You should be able to discuss with them what symptoms of COVID, and that's part of your screening process. We ask that you limit large gatherings. And then, of course, mask and social distance at all times in communal areas. And during an outbreak, educate about the increased risk of visiting and educate about the increased risk of visiting and what kind of PPE should be used at those times. Next. So what do you do if you have a new admission or readmissions? We sometimes would call those observations. So a new admission or readmission whose COVID-19 status is unknown or not up to date with vaccination should be placed in quarantine. You should be using full PPE, and it should be changed between each resident encounter. So you discard it every time that you come from that room. Next. So what is a PUI? There's a little bit of difference. A PUI is a person who has been exposed but currently tests negative and should be quarantined. So if they're up to date, staff should use full PPE to include an N95 respirator, eye protection, gowns, and gloves. You are placed in quarantine for 10 days if the resident remains asymptomatic, or you can use 7 days if the resident remains asymptomatic and tests negative. And that's negative by an antigen test, not by a PCR method. Okay? If they're fully vaccinated or unvaccinated, staff should continue to use full PPE, N95, including your N95 mask, your eye protection, gowns, and gloves, and they should be placed in quarantine for 14 days. Next slide. So this is a slide that we want, people still have some confusion about where do I get my transmission numbers? A lot of that bases on what kind of testing you're going to do and what kind of PPE that you're going to wear. So if you will pass it to me. So this is the one that you should be going to, the CDC tracker. It recommends use of CDC COVID-19 or for provided for healthcare facility uses. So what I want to show you on this is that when you scroll down, you will see an opportunity to put in your state. So we're going to put in Georgia. And for demonstrations purposes, we will use Fulton County. Okay. And you notice that the first thing that pops up when I put that county in is a little yellow dot. It says medium transmission. Okay. That is not the transmission rate that's used for healthcare settings. You will need to scan on down, and you will see this nice little map here. And you want to look for the map that has all 4 colors on it. Okay. High, substantial, moderate, and low. And then you will take your cursor and you will hover over counties, and you'll notice it'll tell you what county it is and what the transmission rate is for that county. Okay. So we were talking about Fulton. So we see Fulton County right now is in high for healthcare facilities. And we'll talk a bit what that induces for you as a long-term care facility in just a minute. Okay. Does anybody have any questions about how to use the website? You would need to go out there once a week, and they ask you to specifically pick one day. So you would always do it on Monday or always do it on Tuesday. Yeah. And remember, if the rate goes up, If you go from moderate to high, you have to immediately implement PPE required for high. But if it goes from high to moderate, you should wait 2 weeks before you change your practices. That gives it time to stabilize. Any questions about that? So now,
Teresa, as we're transitioning back, and please enter any questions that you have about the map or how to use it in the chat or Q&A. We do have one question. If you could talk about what is mask requirements regarding transmission rates in assisted living and then private duty home care. As we're transitioning, if you could address that while we switch slides back to the slides.
okay, I have a graphic here in a minute that will answer the question about in the facilities. Home care, I don't think if it's actually in the home, unless you have patient care homes greater than 25, then the same criteria applies to them that we'll show in the graphic in just a minute. Okay? So the first thing I want to talk about is what is source control. You'll hear the term transmission, or source control. And this makes a big difference in which type of mask that you're going to wear. So if you're using your mask for source control, that refers to healthcare, respirators, surgical masks to contain the wearers, which is your employees' respiration secrets when they breathe, talk, or cough. These are used only for source control. Of any of the options, those staff can use those masks for 1 day, 1 shift, unless they become soiled, damaged, or hard to breathe through. Next slide. Transmission-based precautions, that's someone that actually has the disease or suspected of the disease. And those are to protect their staff from the disease from the residents. So that's when you're going to use your N95 mask, right? And those, if your supplies support the practice, CDC would like for us to go to that you remove it and discard it after each resident encounter. Sometimes that's very hard to do, so you need to look at your supplies and determine, do I have enough to do that? And if not, that we can provide you by request a calculator that would help you determine where your status is and just document why you're not doing that. Because there's lots of times that you have reasons, but make sure your documentation is clear on why you're not disposing those masks after every use, in case surveyor, especially OSHA, that showed up in your facility to ask you about your use. Next one. This is what I was talking about. So when you look at your facility and you look to see what is your transmission rate at that time, you will notice they will be either blue, which is low, moderate, which is yellow, substantial, which is orange, or high, which is red. And if you'll know, based on this graph, masks such as well-fitting surgical masks, KN95s, or OSHA approved, are higher equivalent levels. And it says if you're in low, use a well-fitting surgical mask or a KN95 is acceptable. If you're in moderate, the same thing applies. But when you move into substantial or to high, we recommend that you use universal N95 for health cares during all patient care encounters. And then the second question, and this applies because you are considered a health care setting, it does apply to you. If you're an assisted living or if you have greater than 25 personal care home beds. So, and then the eye protection also follows the same color coding. If you're low, eye protection can be worn. It's really up to the user. Yellow, the same thing applies. But if you're in substantial to high, we recommend that either face shields or goggles be used as universal precautions. Now, did that answer the question about who should private duty? Private duty home care, if they're in my building, I would be expecting them to wear the same protection as if they were one of my employees. Okay. Next one. The things to remember about any face mask, and this is where we would say that a lot of the confusion would occur. You need to ensure that transmission-based precautions are maintained when you're moving a resident or patient from one center to another. So if you're going to take them to the dining room, make sure that they have those masks on, or if you're going to take them to your front door for them to go out for a treatment, make sure that the appropriate PPE is in place. You need to ensure that they know how to put it on, how to take it off, and what are the appropriate PPE to wear in each one. We see a lot of things where people would have N95 mask on, and those should be secure, number one. And if they had the straps crossed, that's inappropriate placement, and there's no way you're going to get an appropriate seal with that. One strap on most of them goes at the crown of the head, one goes at the base of the neck, right? Or it would bleed below the nose, above the nose, or you could put fingers through the sides of a regular surgical mask because they had the straps twisted and it caused a little pleat on the side. So just make sure that whoever's wearing that PPE, that they're wearing it appropriately. Next slide. So this is just a little bit graphic about testing, like if you're up to date on a new admission, transmission-based precautions are not necessary. If they have a close encounter, no quarantine or isolation is required. If they're fully vaccinated or unvaccinated, they should be placed on isolation for, some people say 10 days, some people say 14. Currently we have 10, but for a 14, but close exposures, it's what we went over the other while ago. If they remain asymptomatic, 10 days, they can be removed, or 7 days if they test negative. Well, I did leave this on here about serial testing, but that is not required for ALFs or personal care homes. That's just a suggestion that we maintain for facilities. Next slide. So when should you test residents? If they're asymptomatic, you test and test. Test. If they're asymptomatic and they have close contact with someone with SARS, regardless of their vaccination state, you should test immediately. You should wait basically 24 hours after the exposure, and if negative, again, somewhere between 5 and 7 days after the exposure. And then I gave you a definition of what is a close contact. That's when anyone who is within 6 feet of an infected person for a total of 15 minutes or more over a 24-hour period. So an example of that would be if my staff or a person went in and had 3 5-minute contacts with that person that's positive, that's 15 minutes or more over a 24-hour period. So that's really not very long to establish whether they had contact or not. And your staff, it would be surprising if they were not in that room more than 15 minutes over a shift. Next slide. So briefly, we've seen this about recommendations for work restrictions for healthcare based on vaccination status. This was distributed quite readily, but I want you to know that there is a CDC guidelines for determining what kind of staffing status you're in, whether you're in conventional, whether you're in contingency, or whether you're in crisis. So I gave you that website at the bottom. So if you're going, you need to look out there and determine which status of staffing you're in before you implement some of those work early to return to work criteria. Slide. Okay. So, toward the end of COVID, people were really good about reporting their outbreaks, but as time has passed, we have been told by the districts that they are having some issues with getting reporting done. So I just want to remind you that if you have an outbreak, you should share this with your healthcare providers. You should share it with your residents and with the families as soon as that outbreak is identified. You should also, all facilities should notify the public health department if they have one or greater healthcare workers suspected or confirmed COVID infection, or if you have residents with severe respiratory infections resulting in either a hospitalization or death, and if you have 3 or more residents or healthcare workers with acute illnesses compatible with COVID-19 with an onset within a 72-hour period. Those notifications should go to your local public health department, and they are ready and available to assist you with whatever kind of need that you have. Next. These are some basic infection prevention and control resources because we realized that assisted livings and patient care homes were out of their league when it came to infection control. It's nothing that you really, it was on a very minimal platform that it was done previous to COVID. These are not directly to ALFs or patient care homes, but they are very good basic infection control practices that anyone could do. One of them is that current IP practices in long-term care. It has all kinds of information, not just about COVID, but about cleaning and disinfecting and surveillance and hand hygiene. It's an excellent source, and I would encourage you to have the person at your facility that's going to serve as your infection control person to do that training. It's set up in modules, and you can take all the time you need to do those. Another one was a training from COVID that was done by the CMS for COVID-19 frontline workers. It has a lot of general basic infection control on there. It also has some really good COVID-19 specific information. So I included these 2 links, and I do encourage you to check those out in your time. Next slide. And as we've talked about earlier, our HAI team is divided into districts, and I bet most of you guys have had contact with someone on our Georgia DPH HAI team. I did list each district and who the IP is assigned from Georgia Public Health for those districts and their contact information. And I have to admit that slide's a little bit hard to read, so we may just try to copy this slide, and maybe at the end, if we could send this out to the participants, that would be great. But we are here to help you. We also have the district public health that are here to help you. We work hand in hand. And now we have the partners at Alliance, and they have 2 great IPs that are there to assist you too. So it's a team effort to provide to our long-term care facilities the assistance that they need, not for just COVID, but for other infection control issues. If you have questions about what do I do with a MRSA, what do I do with a VRE, what should I be cleaning with? That's the kind of questions that we're here to answer for you. So please use us as a resource. Next slide. I'm going to turn it back over to Mel.
All right, well, thank you, Teresa. We have had some questions in the chat, and really around the link for the recording. The recording might not be posted until Tuesday. Monday is actually a holiday for us, and so we'll get that posted out to our website. I have dropped the link in. I had someone say that it's not working. If you will copy and paste the link into your browser, please let me know if that's working, because I think it will work that way, to just copy and paste that link in. So in addition to not only this presentation with the recording, you'll have access to all of the other information that we have already posted out on the website, to include the presentation or the training that was done earlier in the week, for not only you all, but you might want to go out and listen to the recording that was done for skilled nursing facilities as well, and bring in some of that information, as Teresa has given several links that might not be just for assisted living facilities or personal care homes, but you can garner some information from those links that might be applicable to your setting, especially if you have memory care units and other areas like that, in addition to just your normal setting. At this time, we should be getting a poll to pop in very soon. And with that poll, we would ask that you do fill it out and give us your opinion, your true opinion, because we take your opinions close to heart, and we really look at that, and we want to know, what do you need? This is the first time, so this is our kickoff today for you all. And we want to know, what do you need from an infection prevention standpoint? We did have the question about masks. So do you have other questions around PPE or what should be done? Let us know that, and that will help us to set up for next month and the months to come. If you go to our website, and again, in just a moment, I'll just put in only the Alliant website, and you arrow down to the Department of Public Health link that we have on there. I think that you will be able to browse by the topic, and you'll be able to find the links. Let me drop that in right quick, like it's Quality Alliant Health .org, and then you browse by topic, and the topic you want to browse by is the Georgia Department of Public Health site that we have set up on our website. So I see that the poll, I believe, has closed, and we thank you for entering in your information and thoughts today, but it doesn't end today. We want to continue on and try to answer your questions. So Teresa, we have another question. If we do input the information in SINs, do we still need to call DPH?
They should be getting that report from SINs. That's my understanding. I can check that to be sure, but I believe they still like to get a call. But if it's going into SINs, they should be getting that information.
Okay, so Debbie, does that answer your question?
I'd like to interject here.
Okay.
I don't believe they would get it as quickly as they would need to get it. So I would suggest the facility contact the local DPH.
That's my thoughts too. I mean, they should be getting, but whether they do or not, I'm not sure. I would contact my local DPA.
Yeah, they may not get it till the following week. So I would definitely contact them so they'll have a real-time notice as to what's happening in your facility.
Good questions. Anybody else have a question?
Mel, this is Linda. I thought maybe if Rakia, I hate to ask you to do something again, if you go back one slide where all those DPH contacts are out, there you go. That's just so helpful if y'all haven't created those personal relationships with those advocates really that you have, that expertise that you have, maybe not exactly in your backyard, but they are close to where you're located around the state. That's one of the great things about the way that our state is organized, is that you have resources at your fingertips, and they're going to be able to really stand in the gap for you and figure out things in the meantime while you're searching all the websites and trying to reach out to your peers. But nice to have that expertise around the state.
Thank you, Linda. And so again, where will the recording be posted? The recording will be posted on that Alliant website that we have provided for you. And I think Rakia dropped in another link as well, but that is our Alliant Quality website, our Alliant Health website, where we will be dropping all the information in. And you will notice every month as we do these presentations or as we do trainings, everything is going to be dropped into that one site. So once you get there, if you could please just bookmark that. Any information that we have, even resources and tools, if we have any of those, we'll be dropping them into that same area and that same site. So as we talk about this, our next time that we'll be together will be on June the 24th, again at 11 a.m. So that's the fourth Friday in June. And if you'll go ahead and just block off some time for the fourth Fridays of each month at 11 a.m. through the rest of this year, we'll be bringing you information just like today. We call these office hours. And so, again, we want to hear from you. We want to hear your questions. And if you can send those to us in advance, just drop us an email and we'll try to make sure that we answer the questions whenever we get to the actual WebEx event. But at all times, if you have something come up, during the WebEx event, please let us know and drop things in the chat or the Q&A box. So I'll ask, some final calls here. If you have questions or comments, or you just want to share something about the good works that you're doing and how everything is going, we want to hear about that too. So next slide, Rakia. We want to thank our folks again. Teresa, thank you so much for today. You've given a lot of information out in what I call a short amount of time from the Georgia Department of Public Health. Regina, thank you for your comments just a few minutes ago as we tried to put clarity on, some of the reporting. We also want to thank the University of Georgia. They're going to be participating as well and providing information. And so again, without our partners, we could not be bringing you this today. Next slide. From us at Alliant Health Solution, we ask that you go out and join us on social media. We have several platforms that we are currently involved with, to include Facebook, Twitter, LinkedIn, and we have several things out on our YouTube channel for some shorts. And we're going to be developing. Dr. Swati Gar is our one of our medical directors. Very soon, we're going to have coming what are called Take Fives. And those are some short video vignettes with information that we feel is very pertinent to either skilled nursing facilities, assisted living facilities, or personal care homes. So stay tuned for our Take Fives, which will be coming out, we hope, in the very near future, or by the time we meet next month in June. So I'm going to do one final call for questions or any information you want to drop in questions or chat. Wait just a second. Regina and Teresa, any parting thoughts as well before we close out today?
I would just like to thank the personal care homes and the assisted livings for the way that they've stepped up to the plate to take care of their residents in their facilities. In a time that was stressful, I've learned a lot, and my cohorts have learned a lot, and our curve was not near as steep as this group of individuals. So I appreciate what you do every day for the lives of the residents of Georgia.
We all agree with that, and thank you, Teresa, for those words. Regina, any parting thoughts?
Yes, I'd like to say to all the facilities to contact us. We are a resource for you. We don't think any question is a dumb question. I was green in infection control at one time, and many times you don't know what you don't know. So please feel free to contact us. This is a lot you're being required to do. This is new. We don't expect you to know everything, and that's why we'll be there for you to support you.
Well said, Regina.
All right, we have one last question, I believe. So Fulton, which is high, will staff on the floor always wear N95 or just one-on-one direct care if high transmission?
We recommend that everyone that is in that unit, when your transmission is high, you never know when somebody's going to come out of the room and you're not going to be prepared. So we recommend that they have on their N95 and their face shields anytime that there's a chance that they may have a resident encounter.
Thank you. And then we have a couple others. Do you come out to facilities to do staff presentations and trainings? So Teresa and Regina, I'll punt that one to you.
I will say we are moving to a different phase with Georgia Public Health, and I hope that I'm not speaking out of turn, that we're going to be looking at other resources for our facilities other than COVID. So that might be a possibility in the future, but right now that's still not nailed down exactly about what we're going to do. But I will tell you, in certain counties, in certain districts, Fulton County, I'm not sure about. At one time they did, but some districts have the resources for them to come to your building and do that for you. I can't speak for all districts. We do work with a couple of districts that does have that educator on board in their district. And so you might reach out to them to see if they have that available. And we may in the future. That was a long answer to say we're not sure exactly whether we'll be able to do that or not, but it may be a possibility in the future.
And then is KN95 okay?
KN95s currently are not, if you have N95s available, that'd be another one of those documentations, because OSHA currently says that KN95s provide about the same protection as a surgical mask, and that they should not be used in times when a respirator N95 or higher is required. So you can use them like their surgical mask unless you have really good documentation on why you're not using an N95.
So I asked for those questions. Did those answers answer everything you were thinking about? Well, I am not seeing anything else come into the Q&A or the chat box. And we did get a yes, that answered questions. So again, Teresa and Regina, thank you for being on today with us from the Georgia Department of Public Health. From Alliant, we want to thank everyone for joining us today and participating. We want to thank you for putting your questions in chat and being interactive with us. And we wish you a very safe weekend. And we hope to see you all back next month in June as we continue with these office hours for this work. Thanks, everyone, and have a good weekend.